How are PET CT scans used to help determine MRD negativity?
You have heard a bit about MRD measurement, it's minimal residual disease. You have heard it's very important that this is as low as possible, that the response to treatment should be as good as possible. The problem is when we are negative with our free light chains, negative with the immunofixation, negative in the urine, we still can have some disease in the bone marrow. And then we do bone marrow biopsy here, which is the easiest way to get it. But the problem is that in a French trial that was mentioned several times now, they found that you can be PET negative, PET or MRI, either one, negative, and MRD positive. So you can stick a needle here, PET is overall negative, and you think, okay, great. Then you stick a needle in here and you're still MRD positive. Or you can be MRD negative, you stick a needle in here, but you have something growing here. So it's very important to have the whole picture, and the whole picture meaning as much of the body to image as you can, plus doing this very sensitive technique with the bone marrow. That's also a question oftentimes coming from patients. Since we have this very sensitive and great imaging techniques, do we really still need bone marrow? The bad news is yes, at the moment we still need it because we have to see how many of the patients, the sensitivity of the bone marrow biopsy is still much higher than our imaging techniques, but we are getting there. And I didn't promise you that we can get rid of bone marrow, so don't get me wrong. So this is kind of demonstrating that. You can see again this dark spot, which is a myeloma lesion. If you put in a needle here, it might be MRD positive. If you put it in this lighter gray spot, it might be negative. So as again, I think it's very important to do imaging plus MRD assessment plus our serum and urine analysis. And this is showing if both is negative, MRD is negative and imaging is negative, then the prognosis is very good. So, and that's what we are going for, not with any means, because sometimes patients just stay in a low tumor burden, but we try to bring most of you in as deep as response as possible.